All right, good morning. My name is Mick Raich, and today I want to spend a few minutes talking about the Affordable Care Act and how it's going to affect physician providers. We've all heard the things in the news about enrollees signing up and the struggles they've had, but let's look at some of the struggles physicians are going to have as they move forward in this process. These health exchanges are going to be different insurance plans that are going to be offered to physicians and hospitals across the nation, and they're going to have to figure out how they're going to deal with this and how they're going to deal with these providers or these enrollees going forward. The truth is, we're no longer going to have a self-pay population. Everyone's going to have to be in some form of insurance plan. How that insurance plan works and how it affects you can be varied across the nation, but there are some simple things that we need to pay attention to. First and foremost, out-of-network. A lot of providers are out-of-network with certain insurance plans so they can get paid a higher rate. This works in certain areas when you don't have to have the referral sources. Well, unfortunately, there'll be no out-of-network anymore. Everything's in-network. Every patient will be in-network. There'll be no option for that. And what will happen is these out-of-network plans, if you are out-of-network, they won't accept an enrollee anywhere to be seen. So what will happen is that enrollee will only have an insurance plan that can take them to the ER, for example, and if they try to go somewhere else, it just won't happen. Another one of the things we're seeing with this is something we called, we're going to call it plan jumping, because you can sign up for an insurance plan and you have 90 days until you have to pay your premium. One of the things that we think can happen is someone could sign up for an insurance plan and 90 days later switch to the next insurance plan without paying a premium. Well, how will that patient be billed? And how will you collect that dollar if that's an issue on your side? We're going to have to figure that out going forward. One of the things that these exchanges are going to do is, for example, a Blue Cross plan in some areas might have a clause in their contract that you have to accept these plans no matter what. So if you accept their HMO PPO, you're also going to accept their EPO plan also. So all the patients will be rolled in here and you won't have the option to say no. That could be very, very interesting going forward. Again, you could, in some places, you could be forced to take these patients. In other places where maybe you don't want to take them, they're going to show up anyways. And you're going to have to figure out how to bill them and how to collect from them. Let's talk about rates. The rates we're seeing right now in the insurance plans are not pretty. We're looking at 30 or 40% less than some of the commercial rates right now. A lot of people think this is equal to a Medicaid plan. And if you've ever dealt with Medicaid, you'll understand the frustration there. For example, it's almost impossible to get someone to call you back. I know some state Medicaid plans right now are taking recoupments from some of the providers from a year ago. There's some very interesting things going on with Medicaid, and we see this as a big issue. Again, you're going to work harder, see more patients, and probably get paid less. So negotiating these rates is going to be the #1 thing you have to do going forward. I believe there is some wiggle room here. Get a good negotiator, break open the plan, and go at it. The terms of these contracts. A lot of these contracts, we're seeing very unique terms. We're seeing terms that say, we're going to accept 10% less than the current rate this year, and then a declining rate every year, 3 to 5%. This could be very, very interesting. So you sign a contract at 120% of Medicare, but instead of getting a cost of living raise, you're actually going to get a rate that goes down every year. This could be very, very, very frustrating, and it's going to lead to a decreasing revenue stream. Pay close attention when you're negotiating these terms. Again, the simple fact is, no one wants to sign a contract that pays you less every year. Your contract should pay you more every year. Self-pay. Self-pay is going to change. Your true self-pay category is going to go away, and you're going to have to look at how you deal with self-pay patients in a different environment going forward. The people that are in these plans are going to have some type of a copay or deductible. Anywhere, if you go from a bronze plan to a platinum plan, you're going to have to pay something out of pocket. My personal plan, I have to pay $6,000 out of pocket. So what does this mean for the billers? Well, they have to look at how they collect their self-pay dollars, and they have to find a different way to do this, and a more aggressive way to do this. We have to change our self-pay thinking. 10 years ago, it was 3 statements and maybe a pre-collection notice, and it went off to collections in 120 to 150 days. That's just simply not going to work anymore, especially with people plan jumping and with higher deductibles. We're going to look at, we want billing companies and billers to look at statement, phone call, and then be done in 60 days to 90 days. No more than that. We want them to get in there, hit it hard, and be done with it. We've found time and time again that That's a very, very good way to collect this money, and it keeps the AR down, and it makes your AR look more viable. The last thing I want to talk about is when you're going to find this. When is it going to hit you? I'm betting second or third quarter of this year, you're going to start to see some of these changes take place. Third or fourth quarter, you might actually see the revenue cycle, or the revenue side decrease 3 to 5%. If you take a look at what happened over the last 5 years with self-pay, you'll notice your self-pay volume in many places went up 2 or 3 or 5%, and your overall collections went down 2 or 3 or 5%. This doesn't count just Medicare, but all payers. I think second quarter, third quarter, end of this year, we're going to see some very unique things when it comes to the revenue side, and we're going to see some numbers change drastically on the negative side. It might be, again, a 3 to 5 or 10% in some areas, depending on how many people they have in the health exchange program, the rates that they sign, and the terms that they have. Again, my name is Mick Raich. I own Vachette Pathology, and I own Stark Medical Auditing. If you have any questions, feel free to give me a call. My number is 517-486-4260. Thank you.